Good morning, Chairman Wenstrup, Ranking Member Ruiz, and the members of the Select Subcommittee on the Coronavirus Pandemic. Thank you for inviting me to testify today on the horrific, preventable tragedy that unfolded in elder care facilities in the spring of 2020 that took the lives of over 16,000 seniors in New York State, including my husband's parents. Mickey and Dee Newman were married for almost 60 years. They lived in the same four-story walk-up in Brooklyn for decades, where they raised 3 children, Donna, Michael, and Sean. Mickey was in the U.S. Air Force and joined the fire department of the city of New York, serving for 23 years in Engine Company 323 in Brooklyn. Dee was a devoted wife, a mother, and a grandmother, and worked at the local dentist office part-time. She never missed a birthday or an anniversary, and there are still days where my husband has the urge to call her on his way home from work, which was part of his daily routine. Before the pandemic, Mickey had a series of health issues. He was in a nursing home for rehab to get into better shape before he could join his wife Dee in an assisted living residence. And then came COVID-19. Sean got a call in the late morning at the end of March 2020 and was told that his dad was not doing well. He had a fever, his breathing was labored. 3 hours later, he was dead. Sean had to break the news on the phone to his mom in lockdown that her husband died. It was the hardest thing he's ever had to do. My husband saw his mom once in early April after that to bring her some flowers. He could not pass the front desk. He saw her in the lobby for only 1 to 2 minutes, standing 10 feet away with a mask on. He told her he loved her, and she started to cry before he left. He would never see her again. A few days later, Dee's health went downhill. She was moved to the hospital, tested immediately, and diagnosed with COVID-19. The last time Sean spoke to his mother, she told him her throat was raw, she had trouble breathing. Despite her ill health, her final words were to ask him to buy Easter presents for her grandkids and to please write her name on the card. A nurse called us the next day to tell us she was in and out of consciousness. The next day, she died. Our grief and our confusion turned to anger in the days and weeks afterward when we learned how elder care homes were turned into death traps. Over 9,000 COVID-positive patients were piled into facilities for 46 days, and no one told the families. 3 years later, we still don't know why. Our former disgraced Governor Andrew Cuomo said more than once that COVID inside of nursing homes would spread like fire through dry grass. He knew the elderly were the most susceptible, and yet he let it happen. He lit the match and he set the fire. All of us here today would like to know the origins of where the March 25th order came from and why nursing homes were prohibited to test incoming patients. It's also worth mentioning that while care homes could not have access to tests, Andrew Cuomo's friends and family were secretly able to secure tests and use state resources to quickly find out the results. The other question we have never had answered is why weren't the facilities provided by the federal government ever used? There were thousands of empty beds in the Jacob Javits Center, the USS Comfort Ship, and other several ad hoc hospitals, while nursing homes were packed with sick people. It was recently revealed that a U.S. Navy admiral on board the Comfort Ship, quote, begged the Cuomo administration to send patients to the nearly empty hospital ship docked on the Hudson River during the height of the pandemic. But instead of helping, quote, his pleas were met with politics and paranoia. Many couldn't see their loved ones before they died or have wakes or funerals. Instead of doing his job to protect our families, the former disgraced governor was busy getting his staff to write a $5.1 million book with various awards, including an Emmy, and blaming everything and everyone else for the mistakes that he made. He likes to say our advocacy is political, but not one grieving family I have met here has told me who they vote for. All we've ever wanted was to have a fair, bipartisan investigation into why so many of our elderly died painfully and alone. The death toll in our senior living facility, September 11th, and Hurricane Katrina combined, There have been hearings and accountability for both those tragic events. Why is this any different? And as much as I am grateful to be invited here today, having hearings alone will not bring justice. We need to learn from this tragedy, to turn our grief into purpose and find out what happened to our parents and our grandparents who trusted us and our leaders to protect them. Thank you.